Hello, everyone, and welcome to our Mother's Health podcast. And this is a podcast where we uncover the real challenges behind the maternal health statistics. On today's episode, we're going to talk about a topic which is very important, and it's called delays in care. I've begun to speak about delays in care from the first episode. So today we're going to dive deep into the 3-delay model. And we're going to use that to understand the reasons why women are dying from preventable causes of pregnancy and childbirth. So once again, I'm your host, I'm Dr. Vivian Chinwa, and we're going to have a fantastic time today. I'll put a little bit of context to the 3-delay model because I believe not everyone is familiar with the models of delay. The first delay that we experience in maternal care is delay in deciding to seek care, often caused by lack of awareness. And of course, our environment, our culture, and our beliefs, even financial constraints, influence our health-seeking behavior and even our mental health and state. Has the ability to influence our health-seeking behavior. And we have the delay in reaching care, which is the second form of delay due to poor roads, lack of transport, long distance. A lot of women live in the grassroots, the rural areas, and it's really very difficult for them to attend sophisticated facilities that are very much equipped. And then we have the third delay, which is inability to receive adequate care due to lack of facilities, especially when these women get to the cities or the town or their local hospitals, and they face all of the setbacks and challenges with lack of supplies and mismanagement and treatment in health care. On that note, I'm just going to introduce our guests. We have very special guests with us today, and I'm very excited to have them. They're going to help me to dive deep into some of these delays, the causes, and what can be done to help mitigate these challenges and situations to improve outcome for women. So our first guest today is Dr. Jennifer Grace. She completed her PhD at the University of Birmingham, UK, focusing on mental health and early intervention in psychosis. She's worked in partnership with the King's Trust, Birmingham Local Authority, and the collaboration in leadership for applied health research. She furthered her studies at the University of Cambridge, focusing on psychotherapeutic interventions, and Jennifer has since established a career in community and healthcare leadership. She has led the implementation of complex healthcare provision, gained valuable insight into social care policy and practice, and currently a senior lecturer. She facilitates the NHS MBA programs and is a lead for social care and curriculum enhancement. Going forward, Jennifer will be focusing on the role of social injustice, inequality in modern systems. So I'm very pleased and delighted to have you here with me, Dr. Jennifer.
It's great to be here. Looking forward to a very thrilling discussion.
Thank you. And just to mention as well, these are my colleagues, so I really appreciate them for being here. And I have a colonel as well with me, very respectable, someone I really, really respect. He's done fantastic also in his career. Mr. Obasi is a lecturer in healthcare management at Adding University, and he's a consultant in healthcare sector. He has over 20 years of experience working in the public health and global health sector in Nigeria and the United Kingdom. He worked in the Ministry of Health in Abia State, Nigeria, and as well as Public Health England. He is a former executive director of the Rural Health, Water and Sanitation Initiative that advocates and facilitates training of frontline healthcare workers in Africa. He's also a 3-time UK general election parliamentary candidate and a Liberal Democrat. So you can see that made great strive in his profession, especially in politics. So I'm expecting him to bring a lot of political insight into the discussion today, especially with his experience in Nigeria. So Welcome to the podcast, Mr. Obasi.
Thank you so much for having me, and hello to everyone watching.
Okay, so go right into our podcast. Explain the 3 delays. I'm going to share some stories, a lot of disheartening stories. By the way, I must say that all of these delays and all of these maternal mortality are very much preventable if some of these delays can be addressed. Okay, have a first case. This is delay in deciding. Okay, a lot of women hesitate to seek care. Now we have Marian from rural Nigeria, experienced severe bleeding after childbirth, but her family waited for a local healer. And this is a situation with many women today. A lot of women will still have to wait on their husband, on local healers, on traditionalists, and on faith-based prophets before they seek appropriate health care. By doing so, delayed, and she lost too much blood, and of course we know the consequences of that. And the second case is Amina in Ethiopia. Okay, went into labor at night and with no transport. Okay, a lot of women suffer these things. They have to travel far. Some women will have to walk or cycle long distances before they get to receive care, maternal care. And we have the third case. This is Grace in Uganda. Reached the hospital quite okay. She made a decision, she traveled, and she got to the hospital in time. But the facility had no blood supply for transfusion, and she passed away much later. This is just but a few stories there. And these are things that can be tackled by system, by the government, by policymakers, and even by community initiatives. Okay, help get women to this facility on time and provide adequate support and treatment for women. So I'm going to come to you, Jennifer. I'm going to start with you, Jennifer, because you have a lot of experience in healthcare management and leading. So I'm going to start with you. And what is contributing to some of these delays in seeking healthcare on time?
I think it's very sad when you just into those case studies. It's really quite sad, and it happens more frequently than people might realize. I feel like the solution has to be layered. There's no one simple solution. And I think the reason we get into these difficulties is because there are so many undertones. So you mentioned things like religion, spiritual things, a patriarchal society where women don't have a voice. You need permission from their husbands to be able to go somewhere or do something. And also in these kind of nations, a lot of issues in terms of transport infrastructure, able to safely away to a hospital, for example, it's just not there. And hospitals tend to be few and far between. So it's very difficult for people to connect to support. So you've got the first issue of culture. You've got the first issue of, religion, but then you kind of on to, okay, infrastructure, those are the problems. But if you even overcome those, when you do get to the hospital, then there's issues with the supply chain. There's issues with drug availability. Some drugs sometimes you'll hear have been expired. Sometimes doctors that are in these facilities or the health professionals don't have the tools that they need to provide adequate treatment. So it's almost like in these 3 major areas, failings, and it's really difficult to come out unscathed. And I think really help-seeking behavior, for that to be improved, there needs to be a lot of education around the culture, this community. So you need social subscribers, you need community leaders to be able to speak to people and explain, to get help, what help is available. So also support policy. So proofing is another approach where policies within those areas are actually proofread and looked through to see that they are amended to meet the needs of that rural area. So they've got to have targeted policies. They've got to specifically meet the needs of each area, because every area is different, every population is different, every group is different. So you need to understand what issues are, what their cultural beliefs are, what their struggles are, and then you can get social subscribers and community leaders to support that and to start to give people a better attitude towards help when they need it. In terms of infrastructure, government funding, able to put things in place. And also there's things like mobile support. So I know recently a lot of things happening in terms of drones. So I don't know if you've heard of it. You've been delivered by drones, AI and all that kind of thing. Going into the kind of digitization, you're going to probably help to mobilize support and help people access more support. They're very far away.
Yeah. And, culture is a part of the people. Beliefs are part of us. And it's been proven difficult to separate women from culture, from religion, and from all of these beliefs. And I believe also that our mental health influences our actions and health-seeking behavior, the state of the mind. You touch a little bit on mental health and how we can help to improve our mental health so that women can feel strong and motivated to seek help and to make decisions for themselves. Because one thing I discovered, that a lot of women from developing countries can make decisions for themselves a lot of times because of the society and because of the culture and because of the environment that they find themselves.
Good point. I think, again, it's not a simple issue, but in terms of supporting their mental health, you've got to go back and look at the foundation. So if these are women that are not permitted to speak up or to contribute to society when it counts, you're going to have substantial low self-esteem. They're going to not feel confident in themselves, and they're going to have very low locus of control, which means your capacity to be able to make decisions and feel empowered and take control over your own life. So if they don't have that control, it's going to be very difficult for them to kind of manage their mental health or even assess themselves of having mental health needs. So again, it goes back to community awareness and kind of not just to the women, but also to the men in the community, to the leaders in the community, and saying, look, your kind of approach, this kind is having a negative impact on women in terms of their ability to reach their potential, their ability to kind of and look after themselves. So it's really about speaking to them and awareness, not just with the women, but those around them, so that they can give them more control, help them to be more empowered. Because the more decisions you make, the more you get confident. The more confident you are, the more you can start to take control of your decisions in your life. And so I think it boils down to really supporting women to feel empowered to speak up.
Yeah, thank you, Jennifer. I'll go to Mr. Connor now. We're talking about empowerment because I think one of the ways to get women to seek healthcare and to become bold and confident in the kind of society, especially in developing countries, is for them to be empowered. From the political aspect and perspective, how can we empower these women? First of all, one, what can be done prevent some of these delays, especially with infrastructure and all of those things that prevent them from getting the right care?
Yeah. Well, thank you for the opportunity to address I feel is a very important issue and often neglected issue. And I'll start by setting the context of just how bad this problem is. 712, estimated 712 women die at childbirth every day. Now, to put that into context, that is about 3 Boeing 7 plane crashes every day. Now, imagine if in the world, every day 3 planes crashes. How much attention would the world be doing to solve that problem? And yet, it's not high on anyone's agenda. And that, to me, it's negligence to the border of criminality. So it's a huge problem. But the problem of women dying at childbirth doesn't even start at the point of childbirth. It goes back to that. Obviously, pregnancy is a 9-month. You have to then investigate, how do women get pregnant? And by the way, the number of deaths, 70% of that happens in sub-Saharan Africa. So it's a major problem for us in developing countries. Of the number of deaths in childbirth, 70% happens in sub-Saharan Africa alone. So it's a significant problem for developing countries. So you have to go back to the point, how are women getting pregnant? Is it planned pregnancy? A lot of it is very unplanned, which means it does not have the support of the community, does not have the support of a family. Also, what is the cause of the pregnancy? What type of pregnancy and what support is around that pregnancy? And especially things like nutrition, Also, you talk about mental health. Is the person getting the acceptance of the pregnancy, the joy, the camaraderie, the community support around that pregnancy? These are important things that play an important role towards having a healthy pregnancy and therefore having a healthy childbirth. Now, we then get to the point of what can society do to address this? What can society do to hopefully avert this? And I come from the mindset that these things come in twofold: cultural and systematic. So you have to, first of all, address the cultural aspect, and that is through education, awareness creation campaigns, making people understand the risks involved and making them change their attitude to pregnancy and how they treat pregnancy in general, but even unplanned pregnancy specifically. Then you also have to address the systematic. So we're talking about emergency services. Do we have the infrastructure for emergency services? If a pregnant woman calls in most of these developing countries, can a pregnant woman dial a number and get an ambulance come out? Do they have the road network to convey a pregnant woman from home to hospital? Do we have the hospitals in place that are adequately equipped to address women when they do turn up? Do we have enough midwives and nurses and doctors and the healthcare professionals that we need? And of course, do we have the equipment? As I said, the journey of pregnancy is a journey of 9 months. So if the woman is getting the support from the onset, she's being screened, she's being tested, she's getting the maternity care and support, she's getting the adequate nutrition, she's getting the family and community acceptance and support. And then you have the infrastructure in place that backs all of that up, then you're going to prevent all of that. But unfortunately, it does seem that, as I said, it is not an agenda that is high on most people's radar, and it then gets neglected. I would like to see, from a political perspective, I would like to see legislation come into effect. I would like to see policymakers making funding available that focuses on maternity health. I would like to see drive towards recruitment of midwives and nurses and have all of those in place targeted at maternal health. And these are the kind of policies that you want to see politicians make. These are the kind of decisions that you want to see politicians make in terms of delivering interventions and allocating resources towards. Those things will happen once democratic institutions are made stronger. But at the moment, it is very sadly lacking. And that is why we have the problem today.
Yeah, thank you for that, Mr. O'Connor. You touched on so many things. I would just like to bring you back to a few things. Male support in maternal care, even as a man. I'd like you to throw some lights on male support in maternal care, because this is quite a problem. Jennifer, you mentioned this as well. Some of the intervention happening in different developing countries is involving men in support. And you talked about that family support. A lot of men are not providing the needed support, or they are being authoritative the way they provide the support, to say have to give birth in a certain place, have to give birth traditionally. Some women will have to wait until their husband gets back from work before they attend to themselves. This is a huge problem. And how can our women be empowered? What are some of those strategies how we can empower women so they can begin to relevant in the society to make these decisions for themselves, regardless of their husbands?
Well, like I said, first of all, it is a cultural shift. It's a cultural shift. And the journey of the birth starts with the journey of the pregnancy. So how did conception happen? And was it planned? And was it accepted? So if you have a situation where culturally was an unplanned, maybe a teenage pregnancy, and the person who impregnated the young lady has absconded, then there's obviously no support. And then if the family of the girl, because of stigma, because of judgment and fear and all of that, decide they're going to either hide or cast aside the child, then that child is vulnerable. And without that support, you're going to have a difficult pregnancy. And therefore, the risk of it is therefore increased. So it's a cultural thing that has to shift with the mindset. So going specifically to the men. Now, men have to have sex education. There's just no, that's the simple about it. So when men start to understand that it takes two to tango, pregnancy is not a woman's problem. It takes two to create a pregnancy. So they will then put some responsibility on themselves to ensure that they engage in sexual activity safely so that pregnancies are more likely to be planned. And you can then hopefully have more planned pregnancies. And even if where they are not planned, they will understand that they have a role. But also beyond the sex education, there has to be policies in place. And this is where politicians come in. So you have to have policies that ensure that vulnerable women who are in circumstances where they find themselves alone and vulnerable and not being cared for, that they are not abandoned, and that there's resources to provide and protect those vulnerable women who may have gotten pregnant as a result of circumstances that did not anticipate. So it's recognizing that it's not a time to blame someone and go, well, in a lot of these societies, as I said, culturally, there's a lot of blame game going around. There's a lot of shaming. There's a lot of stigmatization. And because of that, people hide away from the shame and the discomfort of having to say, I've done something that society maybe perhaps abhors. Therefore, they even almost feel ashamed and almost accepting of the suffering that comes with it. And that is not right, because essentially you're punishing two people. You're punishing the woman and you're punishing an unborn baby that obviously did nothing wrong. So I think it's a cultural shift. Educate the men, sex education for the people. Also policy shifts by politicians, by policymakers, ensure that the resources are available, that rules are in place that will protect vulnerable people.
Thank you so much. I was going to come to you, Jennifer. I don't know if you're okay to talk yet. Talk about how we can empower women. Empowerment is very important. How can we empower women in these communities?
I think it's really important that we do so, as Connor said, by looking at education, looking at the culture, and changing a lot of those stigmatizing attitudes. And that comes with education, that comes with speaking to the leaders in the community. But I think it's really important to note that there are also some barriers. You might stop people from help or going to get support. And those barriers could be experiences, previous experiences, financial burden. A lot of these services are not free. It puts significant financial burden on the families and these communities when they're in a situation where they're having to pay for medication, they're having to healthcare, and a lot of them can't do so. Kind of results in a lot of cutting corners, really getting the full care cycle, the full care process. So they might start medication or start support and then not finish. So there's a lot of disruption in being able to access and have quality care. So it's really about looking at the experiences and maybe undoing some of those negative experiences. Because what happens is if you have a negative, painful experience, childbirth, you're unlikely to try and go back to access help or services. Because you're going to be like, when I last did that, it caused so much confusion, so much problems. A lot of issues there with trust as well. And we talk about sub-Saharan Africa and rural areas, but what you'll find is even in Western systems, you'll find that the third part of the model, where we're talking about receiving adequate care, in Western systems, you'll find that statistics are quite high that of ethnic minorities have less outcomes in terms of maternal health and childbirth. Why is that so? Here we have all the infrastructure, we have the policy, why here we have the training, the professionals. So why are we still having this discrepancy? So again, it goes back to looking at people's individual perception and mindsets, but also their experiences of support. And if we look at systems, historic gynecology experiments on Black women. And there was very much an understanding of women don't feel pain as much as Caucasian counterparts. So they were used a lot for experimentation, eugenics and things like that. So Black lady might go into the hospital to get checked for something, and then before you know it, they've removed her ovaries. So if you look at historically, there's some foundational issues here, serious ones that perpetuate a lot of the distrust in healthcare services, even beyond Saharan Africa. So it's really, how do we deal with this, not just culturally, systematically, but historically? How do we change these perceptions so that we can start correcting certain things in people's minds? Sometimes you go to the GP and you say your vitamin D levels are quite low, but that's okay for your race. And in my mind, I'm thinking, think to myself, what has race got to do with optimal care? If the levels are low, surely you should be giving me something to raise them. But almost an acceptance that actually that's your problem in your culture, so we don't need to treat it because it's common in you guys. There's a lot of issues when we talk about increasing healthcare professionals. Who's doing the training, giving us the information that we need in sub-Saharan Africa? Where are we getting the training? Where are we getting the professionals? So we have to look at history and look at the issues with the Western world, because oftentimes they're the ones that transfer the knowledge and the supplies to these areas. So there needs to be a real digging deep and assessing all of these things so that we can either trust in the community, repair negative perceptions of healthcare within ethnic minorities, and so there can be more trust in the community and more training and expertise in these areas.
I do agree with you. Do you want to come in?
Yeah. I think Jennifer made a very important point. And I think there's an area of focus that we need to really look at, and that is patient experience. It is the patient experience, and how can we improve that patient experience? Unfortunately, at least as far as I know, in developing countries, experience patient focus centered care is not really the model of care that is provided, because so basic and so skeletal. They're even worried about getting the service rather than the quality of the service or the experience from the service. And then you end up having a very bad experience, and that would lead to a delay in people accessing care and looking for care and even making decisions to get the care. Because if you've had a bad experience, you don't want to repeat it. You would hesitate to go back and get the same experience again. Making services patient focused. And one of the ways you do that, in my professional life, I've learned that what doesn't get counted or monitored is not improved.